Hi, I'm Kelly. I'm a CBT therapist and forensic psychologist. Today I'm going to be helping you to understand hierarchies. So, hierarchies are something that I use across my practice, and they can be great for working with phobias, for social anxiety, for anxiety, generalized anxiety, and just for things that people may avoid. So, as you can imagine, there are loads of different ways you can do it, but the setup is actually the same and it's relatively simple. So, what you want to do is first, obviously, figure out what you're working with your client with, or if you're doing this on yourself. So, if we use the idea of phobias, it's probably the clearest and it will be quite easily transferable to the other areas. So you get someone to look at the range of situations that they avoid because of their phobia. But remember, this could be because the things that make them feel anxious or just things that they avoid. So list all of the things. So for example, it could be looking at a picture of something that they're fearful of. So it could be a needle, a spider, a dog, anything like that. Then, or it could be watching a video. This is really going to be individual to the person that you are working with. So some people may be able to look at images, but they couldn't watch something on TV about the chosen topic. Whatever it is, get them to list out all of the situations, from the ones that feel less exposing, such as pictures, to maybe even going to get a blood test, which may be right up there. And at the moment, the things that are going to be at the top of their hierarchy are going to feel like, I can definitely not go there, not going to do it, it's not going to happen. But they will get there, trust me. So you get the whole list of everything from the most doable to the one that seems really out of reach at the moment, and everything in between. Don't worry if you have loads of things on the hierarchy. And then what you want to do is to get the person to rate how much distress they feel when either they watch that picture or they see someone getting a blood test or they go and get a blood test. You can do it from 1 to 10, 0 to 100, it doesn't really matter. But what you want to know is how much distress that scenario causes. So, for example, if we flip it over to social anxiety super quick, that someone could feel really, really super anxious of going to a family party, but they may feel okay to have a phone call with a friend. So you can see the difference. And then you get all of the data that you have, and then you start to work up the hierarchy. So you look at the things that make someone feel less distressed. Some therapists argue that you shouldn't start with anything that's less than 40% or 4%, because you need some of that, the anxiety and the emotions that come with it, to get them to see that the anxiety will die down when they do the exposure, or when they do maybe a behavioural experiment, but probably more exposure. And then you work up the hierarchy. So you set up exposures for the individual to go and expose themselves to that situation that normally they avoid or that brings them distress. And then you just work through the hierarchy. That's it. Obviously, there may be some barriers that come up, and you may want to do some of the exposures to the feared situation in the session. If you can do that as much as you can, then that really is good. But there's going to be some situations that aren't doable. But also, don't be afraid to go outside of your therapy room. If someone is really fearful of just going to watch someone getting a blood test, you go and get the blood test and let them watch you. So that's just an example of how you could take it outside the therapy room. Or if it's about talking to someone in maybe a supermarket, do the session in the supermarket. There are so many ways that you can be creative with this. And as you work through the hierarchy, you know that it is time to move on to the next part when their distress has dropped by half. So whatever they rated that distress with at the beginning, when that's dropped by half through them doing the exposures, then it's time to move up. And you continue to move up and up and up and up the hierarchy until you get to the bits that are at the top. And remember that when someone does kind of achieve that one of their layers on the hierarchy, they need to continue to do it. Don't, just because you've done it doesn't mean you can never do it again. You need to continue to build that, and it is that habituation, is that exposure to the situation that makes them more able to continue to climb until the phobia has completely subsided, or the social anxiety is completely subsided, or the generalised anxiety, or whatever it is that you're working with. So I hope you found that helpful for thinking about how you can use hierarchies in session. I've got loads of other videos about CBT skills and lots of other mental health bits in general, so please like and subscribe and check out my other videos. Thank you very much.